Okay, before going into the patient's room, I would check the chart and make sure that there is an order for the foley and making sure that this is the right patient. Hello, I'm Alyssa. I'm going to be your student nurse today. Can you please tell me your full name and your date of birth?
Mary Smith, 10/10/1990.
All right, Mrs. Smith. So today we are going to be inserting and removing a foley. I would make sure that the bed is high enough at waist level. And then, Mrs. Smith, we are going to have you in dorsal recumbent position. So I'm going to lower this blanket. And then I'm going to lift up your gown. I just want you to put your knees up and spread your thighs as much as you can. And then if needed, I would have another nurse in here with me to help open up the legs or provide some lighting. All right, Mrs. Smith, so we're going to start off with pericare before we begin. I'm going to wash my hands and put on clean gloves. And then in my bucket, I would put warm water with soap. And then, Mrs. Smith, are you allergic to any latex or iodine?
I am allergic to iodine.
Okay. So I'm going to start by putting this in. I would have the patient lift up their hips to better get this under there if they were able to. Alrighty. And then when providing pericare, I would go top to bottom, out, inward to out, using different parts of the towel each time. All right, Mrs. Smith, I'm just gonna wash my hands again and then get all set up and we will start. I would make sure, since this is a sterile procedure, that this wasn't expired. And then I will make a little garbage bag. Mrs. Smith, I'm just going to leave this right here to use as a garbage bag during the procedure. And then I would make sure to open this away from me.
In the NG tube insertion, I'm gonna insert the tube through your mouth.
Alrighty, and then I'm going to start by putting on my sterile gloves.
It's a little bit uncomfortable, but I'll try to make it as comfortable as possible. And you're gonna gag a little bit, and I want you to understand that it's normal to gag. Right before I start anything, I close my curtains and I will raise the bed to my working level and your head to
Alright, Mrs. Smith, I'm just going to start by laying down a couple of pads to keep your bed clean. And then I'm going to drape this over you.
I'm gonna put on my gloves. Get everything ready for the procedure.
And then I'm going to move this over here, making sure to keep it on my sterile field. And since my patient is allergic to iodine, I'll throw this away. And I will be using the hydrogen peroxide. I'm going to start by opening my hydrogen peroxide, pouring it all over my cotton balls. And then I'm going to use these just to make sure that the cotton balls are all drenched in the solution. I'm going to open my lubricating jelly, pour it in.
Over your chest. This is just in case to catch any secretion during the procedure.
And then I'm going to open this.
The pin. If you need to split or vomit.
And then making sure that this gets in the lubricating jelly. And then I'm going to take this and insert it into here so it's ready for later. Alright, Mrs. Smith, I'm going to start now. First, I'm just going to use some cotton balls to make sure everything is cleaned properly.
And measure the length.
Okay, I'm going to start outward and move inward, making sure to open it so that the hole is visible.
The Zapper process. And I'm gonna mark this down using tape.
And then I'm gonna go in the middle. I'm gonna go in the middle twice.
Right. Then I'm gonna go ahead and put on on some lubricant.
All right, Mrs. Smith, we are going to begin now. This is going to be a little uncomfortable, so just take a deep breath. Okay, here we go. 1, 2, 3.
I'm gonna go ahead and
I'm going to put it in about 2 to 3 inches until I start seeing urine come out, and then I'm going to insert it in an inch more. And once it is in,
which nostril is better for insertion, I'm gonna
I am going
ask
to
patient take a deep
slowly
breath on each side,
put in the water to blow up the balloon.
and I
You want to do
see
this
that the one
slow
on
so
the
you
right
don't
side
irritate
is
the lining.
better for insertion. So I'll just go ahead and start inserting. When I start inserting my tube, I'll make sure
Okay,
the
and then I'm just going to
patient's
tug on
head
it to make sure that it's
is
secured
against
in
the
place.
bed.
Alrighty, it's
And
good.
I would
And now if I
expect
needed a
patients to
urine
start gagging.
sample
Once
for
tube
the
reaches
first
the
catch, I would get it
as soon
straight
as
out
they
of there.
start
And if not,
gagging,
I would get it
I'll
out of here. I'd clean out with an alcohol
ask
wipe.
them to touch their
Alright, Mrs. Smith, we are going to secure
chest
this to your leg now.
give him a cup of water and ask him to swallow while I insert the tube. Okay, if the gagging persists, I will go ahead and check the placement of the tube using the tongue blade.
And then I wouldn't want to pull it too tight to make sure she has a little bit of movement.
Try to arrange it. If still the gagging persists, I will go ahead and stop the procedure right
And
away.
then I would take this, making sure that it is below her bladder level. And I would just hang it on the bed.
Inserted, I'm gonna put a temporary securement.
And then I would clean this all up, dispose of all my stuff. I would provide additional pericare just in case any like lubrication got on her or anything.
Once that is
And
done,
now we're going to be
I'll go
removing
ahead
it,
and
Mrs.
check
Smith.
the
I would put her back up. I would do hand hygiene. I'd change my gloves. The first thing I would do is
so for the placement,
I would
we
put a
can
chuck
use
pad
two
on the
methods.
ground and
One
use a
is the
graduated
pH
cylinder
method,
to
other
remove
is
the urine out of the
X-ray.
bag.
I'm gonna
And then
use
I
the
would
pH
measure it
method,
at eye
which is I'm
level.
gonna
And now I'm going
do a
to
suction.
take this off.
check on my pH meter, and once that is done,
And then I would grab the bag and I'd put it in the chucks pad that I just laid out. Alright, Mrs. Smith, I'm going to start by
make sure
deflating
that
the balloon.
placement is right. I'm gonna go ahead
I would
and,
draw out the water. I'd let gravity do it, but for purposes, I am just going to
secure
pull
the
it
tube
out.
more properly.
Alrighty, Mrs. Smith. On the count of 3, I'm going to pull it out. If you just want to hold your breath. Ready? 1. Take a deep breath, not hold. 1, 2, 3. And I'd make sure I'm coiling it in my hand. I would set it in the chucks pad, and then I'd roll it all the way. I would also provide pericare just to make sure that she is all clean. I would put her back, make sure she's comfortable, the bed's in the lowest position, and that the collet is within reach. And I would ask her if she needed anything else before I left.
Nope.
It's done, I'll remove
Thank you.
the one